Hi guys, I just want to highlight based on a patient who I seen recently about some of the early symptoms which you see in patients with hip impingement. One of the classical symptoms is this sort of feeling of prolonged stiffness. So they feel like they need to stretch all the time and they have difficulty in especially deep squats, and they feel like it's a more a mobility issue rather than an intra-articular pathology. So they usually go on social media, see a lot of mobility drills, and it gets flared up. So this case, which he's going to talk about shortly, he goes through his sort of journey where he had it for about seven to 8 years, where he felt there was sort of restriction, more muscle based, but then he was pushing, and that symptoms got worse. So if you have a young patient who has the feeling of constant feeling of stiffness, and especially with prolonged sitting, and difficulty with deep squats, that's sort of your classical presentation of impingement. And usually mobility drills, especially into internal rotation and flexion, makes this worse. So again, if those sort of symptoms are making it worse, it might be a good idea to stop them and to seek somebody who has got expertise in hip and groin. Thank you. So Elliot, so we just started your rehab program for your hip impingement. So tell me about your symptoms, about the stiffness, which started all this many years ago.
Yeah, so basically I've got terrible mobility in my leg. Like I cannot rotate my right leg out too far, and I cannot bring my knee anywhere close to my chest. If I'm in a position for too long, say I'm on like an aeroplane or like a long car journey and my leg is sat in a position too long, it turns into a horrible dull ache. I did a deadlift in the gym before I came to get your help, and I did a PB, and I think all the weight must have gone on my hip impingement area, and it completely ruined it. I couldn't walk on it for days, and it hasn't got better since then.
Yeah. So tell me about the stiffness. Did you have this for a long time?
Yes, I've had it. I think so. I'm pretty sure it started when I stopped playing football, and that was about 8 to 9 years ago, and it came on slowly after that, and I didn't really go to the GP. I just thought I'd fight through it. Didn't really, just thought, you know what, it's probably tendonitis or something. I'll just stretch it out, whatever. Didn't. It stayed for years and years and years, and it's ended up getting worse.
Yeah. And did you feel like you have to push the stretches to make it better? Is that what you thought initially?
Yes. Yeah. No, I assumed, I sort of self-diagnosed what it was. Obviously that was wrong, so I thought stretching would be enough, but clearly coming to get it diagnosed and get it sorted out was the correct approach.
So what would you say? Obviously we can't say for everyone, but for somebody who's been suffering for a lot of stiffness in hip, and they're trying to push through a lot of videos and through social media, what would you say to them?
I would say if you're suffering from stiffness, go to the GP and get it sorted out straight away, because if it's something like this, then it needs to be sorted out, and it will only get worse. Especially if you go into middle age, old age, it's something that will deteriorate massively. So get it checked out, get it sorted out.
Rather than keeping on pushing it through pain.
Do not push it. Do not fight through it.
Yeah. Thank you.